Okay, so you're called to a code 3 21-year-old male who is having difficulty breathing, and you're called to a construction site.
Okay, so with that information, Riley and I are just going to grab our construction equipment. We're probably going to have our hard hats ready. Not sure if we're going to be needing them, but we're going to have them on standby just in case. And as we're pulling in, we notice that the construction site has easy egress and or access and egress. We're able to drive in, park in the parking lot, and have easy access to the site. Now, is anyone meeting me as we park in the parking lot here?
Yeah, I'm just the boss here.
Hi there, what's going on today? Were you the one that called us?
Yes, I did, yeah.
Okay, my name is Ice. This is Riley. We're here to help out, okay? Perfect. Yep. And what's the situation?
Just one of my workers here, he just started to have, he said that he couldn't breathe, and so we just moved him inside to the office.
Perfect. So we're going inside, right?
Yes, you're going
right? Are you going to be meeting any staircases or anything like that as we go in?
No.
Okay, so we won't need our stair chair. If anything, we can keep our hard hats on the stretcher here. We're not on the construction site, so we won't need them as of right now. And we're able to get in. I'm just doing a quick sweep. Does look like that the window is open. Does look like our patient is, we have one casualty here. Looks like he is a 21-year-old male in respiratory distress here. The environment, it does not appear to be contaminated with dust or fumes or anything like that, since we are indoors, and the environment is air conditioned here. Other than that, it does look like we have a clear entrance and exit, and let's go ahead and approach. In terms of additional resources, let's hold back from that right now. Let's have our phone on standby, and due to the patient's condition, let's go in with full PPE. Okay. Just due to the COVID times that we're living in. Now that we have our full PPE on, let's go ahead and approach. All right. Hi there, my name is Ice. What's your name? Salim, you're not breathing too well, buddy. You okay? All right, I'm just gonna help you out. Is it okay if I feel your pulse? Okay, your goal is just to stay in a comfortable position here, okay? All right, so I'm feeling a strong, rapid pulse. I'm just gonna go ahead and listen to your breathing. Make sure you stay comfortable, okay? We're gonna work around you here. Deep breaths in. Good.
You're going to feel a little bit of tightness here, okay, Celine?
So I'm hearing deep or strong, regular breathing, clear air sounds apex to base.
So you're actually hearing wheezes bilateral, apex to base.
Okay, so Riley, I am hearing wheezes throughout from apex to base. I'm just going to keep a note of that, okay? All right, I'm just going to take a look. Salim, if you can open up your mouth. Are you choking on anything right now? No, it does appear that his airway is clear. I do notice some swelling around the throat as well. Okay, so how long have you known Salim for?
He just started with me like last week.
Okay, so you're not too familiar as to what he looks like?
Kind of. What
Does
do
he
you
look
need?
a little sweaty to you today?
Oh, yes.
Yeah.
I think he is.
Yep. You have asthma. Okay. Thanks for letting me know. Do you have your puffer with you today? Have you taken your medication? No. Okay. So we're going to help you out. So are you... You have an allergy to dust. Okay. So this probably might be triggered to the environment. So what we're going to learn from that there, I'm just going to go ahead, Darcy, or ma'am, if you're able to just close the window here, just so we're completely isolated from the environment.
Yeah.
Okay. So, Salim, you were outside for how long today? How long were you working before you felt difficulty breathing? About 30 minutes. Okay, so just continue breathing with me. I'm just going to show you what we're doing. All right, deep breaths in through the nose and blow out like you're breathing through a straw.
So, while you're doing some breathing there, I'm just going to let you know that our blood pressure was about 130 over 78.
Okay.
Our rest rate is 28,
Okay.
deep and irregular.
All right.
The heart rate was 132, sorry. And our SpO2 is at 88 right now.
Okay, so he is satting pretty low. Especially, I'm just going to confirm some medical history with him before we get him on oxygen there.
Okay.
But if anything, I believe we're going to need the NRB, the non-rebreather. Perfect. All right. Has this ever happened to you before, Salim? Yes. And after you take your medication, is it usually better? Okay. Do you have any other medical history? I know it's tough for you to talk. If you want, focus on your breathing. But do you have any other medical history that we need to know about? Just asthma. That's it. Okay. And when was the last time you took your medication? 2 weeks. 2 weeks. Okay. And it made you feel better, right? All right, we're gonna give you some oxygen just so we can get you breathing a little better. All right, I know you're very uncomfortable right now when it comes to breathing, so let's help you out with that. Okay, I'm just gonna go over to the other side here. Is it okay if I lift up your shirt and take a look at your chest? All right, I do want to see that if there's anything physical going on as well. Is that okay with you? Oh, not. So we're just going to go ahead and lift up. I'm just going to go ahead and see. Am I seeing any signs of barrel chest?
Yes.
Yep. Am I seeing any tripod? Or I see the tripod position. Am I seeing any accessory muscle use as well?
Yep, you're seeing accessory muscle use.
Seeing some accessory muscle use as well. Am I seeing any signs of any medical scarring or any tattoos? Anything? Medical bracelets?
Nope.
Nope. And is there any indication that this is the traumatic event after I lifted up the chest there?
No.
Or the shirt there? Perfect. Okay, so let's keep that in mind. Take that
I'm
as
just
a
gonna put some of
consideration.
these stickers on you, okay? Just so you can get a better look at your heart.
There we go. Okay. So, do you have any pain in your body right now? Do you feel any chest pain? Now, I know it's tough, but if you had to describe it, how would you describe your shortness of breath? Did it come out of nowhere, or did it gradually get worse? Okay, that's fine. On a scale of 1 to 10, is this the worst that it's been in your life? 10, really, really bad? So it's a 10, right? Okay. We're gonna get you some medication, but we're gonna rule out something with our 2-lead here, just to get a picture of the heart here, okay? Once that's done, we're gonna give you some medication that you're familiar with, all right? Okay, good. So, does the patient appear sweaty at all?
The patient's a bit diaphragmatic, yeah.
Okay. Or do you feel like you need to throw up? No. All right. You are short of breath, and you mentioned that you don't have any chest pain right now, right? Good. Okay. We're gonna get you some medication once we get this
So,
going.
as I set up the,
The 2-lead.
yep.
Thank you for
Set up
that.
the 2-lead. I have the oxygen ready,
Perfect. Let's get him on the non-rebreather there.
and then I also have this hooked up,
Okay.
so you can get a better look at his,
Yep. Sounds good. So let's go ahead and give him the non-rebreather. So this is just going to be pushing some oxygen in. Just breathe normally as we were practicing. Okay, deep breaths in through your nose and out through your mouth. Okay.
And I have what do you want the non-rebreather set at?
So let's go ahead and set it up at 10 liters to begin, and we'll see how he responds to that. Okay. So
I agree.
10 liters. Awesome. Thank you so much. Once that's set up, partner, if you're just able to get salbutamol set up here, I do believe he's bronchoconstricted. I'm going to take a listen to his lungs again to see if we're improving. I know we just gave him some oxygen, but let's see.
Okay.
Perfect. Do you have records of his medical history with you by chance?
Yeah, I can probably pull it up for you.
Okay, so I'm just concerned. I know he's not able to speak too well right now. I just want to cover all bases to see if we're missing anything before we do medicate him, because we want to make sure we're doing something that'll help him rather than
Sure.
harm him. Okay?
Yeah,
If
I'll
you can
go
just confirm
get it for
me.
you. Yeah,
Thank
of
you
course,
so
of
much.
course.
So I am unfortunately still hearing those wheezes right, okay? We did just get him on oxygen, so let's get that salbutamol set up, okay?
Okay.
So
I have the list here, actually, if you want to see
Perfect.
it. Yep, just saying if he has asthma and he's allergic to dust.
okay, perfect. Thank you for clarifying with that.
Yeah, no
And
worries.
if you can just make sure we have a clear path out, just so we
Sure.
can get him out as
I'll
soon
get my
as
guys to
possible,
clean it
okay?
up for you.
Perfect, thanks so much. All right, so here's the thing. We're gonna give you this puffer. This looks familiar, right? You've taken this before? Okay, so we're gonna give you a little bit more than you're used to. We're gonna give you 8 puffs of the medication today. But we're gonna use this MDI filter. It's gonna help get the medication straight into your lungs. Okay, have you used this before? Okay, let's go ahead and help you out with it. We're gonna give you the first spray.
So
Just to confirm though,
Ventolin 100 micrograms, not
Perfect.
expired.
yep, I do confirm that is what I'm seeing here. It is not expired. Ventolin 100 micrograms. Awesome. So let's go ahead and get that going. You're not allergic to this medication, right? You're not allergic to Ventolin. You've taken it before. Okay, thanks for clarifying that with us.
And you're okay taking this medication with us today? Yeah? Okay.
Okay,
So we're gonna hold it up to your face, and all you're gonna do is just keep taking some deep breaths, okay? We're gonna try and get some deep breaths in.
There we go. I know it's going to be uncomfortable, but deep breaths. We need 4 deep breaths before we can give you the second puff. Ready?
Well, actually, that's pretty good.
And go. 1, 2, 3, and 4. All right, I can sit with this right here if we can get ready with extrication.
Yeah,
together with things
I'll
and
just check
spring.
them.
Deep breath 1, deep breath 2, deep breath 3, 4. All right, get the next one going.
I'm gonna take another blood pressure while you're giving medication.
Spraying. This is number 3, just to clarify. Good breaths. Great job.
Have we noticed any improvement with our SpO2 since putting him on oxygen?
SpO2 increased to 90.
Okay, perfect.
Go again. Spray. 2, 3, and 4. We're halfway there, Salim. You're doing great, okay? You feeling dizzy at all? Still harder breath. You're trying really hard. I appreciate that, okay? 2,
Does our monitor show us any changes in the heart rate?
3,
No, it's
and
the same.
4. Okay, 2 more to go, okay? And spray. 2, 3, 4. Good.
No changes in vital except SpO2. We've increased from an 88 to a 90.
Perfect. Thanks for informing me of that. Before we move him, I'm just going to give him these last 2 rounds here, and re-auscultate, and maybe we can get him into the back of our ambulance before we consider the second dose of this. Great breathing, Salim. We've only got 1 more, okay? So I'm just going to mark the time there. The time is 3:04. So let's start considering the second dose of salbutamol in about 5 to 15 minutes. Okay, we'll see how he's doing. That's totally okay. Here, let's put this away. That's okay. That's okay. All right. So now that that's been put on there, all right, I'm just going to listen to your lungs again. Okay. Perfect. So listen. Good deep breaths. There we go.
That's time.